Hello everyone, we're going to start with the introductions. My name is Tani Molina and I'm the special education teacher. We also have the speech and language pathologist, the occupational therapist, the general education teacher, the principal, the school psychologist, and the parent. So the purpose of this meeting is an annual IEP meeting for Lennon Partida. And the present levels of Lennon is the teacher reported that Lennon is reading at a kindergarten level. He knows all his alphabet sounds and letter names. As of now, he is in the sound by sound blending stage. He is able to read to a CVC and a CCVC words by blending them sound by sound. In writing, teacher reports that Lennon is not able to write a complete simple sentence without support. His penmanship is fair enough. He attempts to transfer, like copying words from the board. He is able to write his name. And for the math, teacher reports that Lennon knows and writes his numbers 1 through 100. His understanding of math is at kindergarten level. He has scored 60% on his last 3 math assessments. Lennon is able to he's able to add and subtract within 20 with the use of a tactile support. For his physical, which is gross motor, fine motor, vision, and hearing, the occupational therapist reported that Lennon demonstrates a L-handed tripod quadruped grasp. Lennon is able to copy letters of the alphabet with 44% legibility, 31% baseline alignment, and 65% letter formation. He is able to write his name 67% legibility, 100% letter size, and 0% baseline alignment, and 100% letter formation. For the oral and communication, as of now, Lennon is able to communicate his wants and needs in his classroom setting, functional and effectively. And his speech and intelligibility is judged by a 70%, although he does demonstrate syllable deletion in some multisyllabic words. Receptively, Lennon is able to follow 1 or 2-step direction without gestural cues, and is able to understand complex sentence. He is also able to answer simple questions and can recall details from short stories when given visual support, like pictures, for example. So for social emotional behavior, Lennon for the most part, he's happy and cooperative. He is energetic. He is able to follow classroom and school rules. If something is hard and he does not want to try, he will occasionally refuse to try and act out, or will throw a tantrum. The teacher reports that Lennon gives up easily on his learning or the activity that he's unable to perform. So it's usually like unpreferable like task. He will usually get frustrated and he runs to the break area and throws himself on the beanbag, showing a sign of frustration. For adaptive, Lennon can take care of himself appropriately and use a bathroom. So the family's input of the student of his current performance is, so mom reported that Lennon is a sweet kid. He enjoys playing by himself. He prefers activities for short amount of time, hands-on activities, and arts and crafts. Lennon benefits from small group instruction, the use of visuals, and manipulatives. So for is that correct? Is there any questions and concerns at this time? Okay. For the goals and objectives, so our first goal is in the skill area of speech and articulation. So Lennon requires verbal reminders for sound placement when pronouncing F in the sentences. He continues to present a P sound of substitution in all the word contexts and in conversation speech. So his goal for this year is by November 7, 2024, in a small group setting, Lennon will produce F sound in all positions of the words in spontaneous sentences, elicited through a 15-minute conversational language sample. Sorry, not 15 minutes, 10-minute. With adequate speech to support the listener's understanding, with 85% accuracy, given one verbal reminder as a measured by observation and data collection and implemented by the SLP across 3 consecutive sessions. The second goal is the fine and visual motor. So Lennon is able to copy the letters of the alphabet with 44% legibility, 31% letter size, and 35% baseline alignment, and 65% letter formation. So his annual goal will be by November 7, 2024, Lennon will be able to copy 26 out of 26 uppercase letters from a near-point model on line paper with 75% accuracy for letter formation, sizing, and baseline placement in 3 out of 4 opportunities, with adaptations as needed, letter blocks, highlighted baseline, and no more than 2 verbal prompts, as measured by collected work samples and observations by the teacher and the OT. The third goal is reading foundational. So Lennon is reading at a kindergarten level, and he knows all his alphabet sound and letter names. As of now, he is in the sound by sound blending stage. He is able to read CVC words and CCVC words by blending them sound by sound. Lennon has a difficulty time identifying long vowel sounds in a word and decoding 2-syllable words. So his goal for this year is by November 7, 2024, when given support, a list of 20 one-syllable long vowel words and or 2-syllable words. Lennon will decode to read the words out loud with 80% accuracy on 3 out of 4 trials, as measured by teacher records or progress monitoring assessments. So the fourth goal is staying on task. So Lennon has a difficulty staying on task. He will often get distracted in class, which results of him not beginning tasks in a timely manner. If he does not understand something, he will easily give up. So his goal for this year, by November 7, 2024, when given an unpreferred task or direction, Lennon will begin the task within 2 minutes. He will stay on the task for at least 10 minutes with no more than 3 prompts. For example, verbal prompts, gestural prompts, and will ask for support if needed without giving up easily. 4 out of 5 trials, as measured by teacher observations and or records. So this Is there any questions about the goals? Do you agree with the goals? Okay. So for the services, Lennon will receive a speech and language services for 90 minutes served monthly, and he will also receive occupational therapy sessions for 30 minutes. And it's 60, so it's two times a month for 30-minute sessions, and it's 60 minutes monthly. So Lennon does qualify for ESY to support him in maintaining his present levels on goals and not to show regression. He also receives transportation to school and from school. Is there any questions, comments, or concerns you have? So we have discussed his goals for this year and his services. He will keep receiving services, and we are done the meeting. Thank you very much.